In the late 1990s, care for Parkinson's disease in the Pacific Northwest here was still quite fragmented. People with Parkinson's had to go one place to see their neurologist, another place to see a physical therapist, maybe a third place for psychological help. So a group of forward-thinking individuals decided that there ought to be a center, a single site, where patients, people living with Parkinson's disease, could come and get that comprehensive care from a multidisciplinary team employing the most advanced approaches to care for Parkinson's disease.
We have many diagnostic tools at our disposal, from, of course, MRIs, PET scans. We are one of the few centers that provide skin biopsy for alpha-synuclein that aids in the diagnosis of Parkinson's disease. We have a large group that aids a movement disorder doctor in the challenges that Parkinson's disease poses on patients. We do have a great rehab group, physical therapists, occupational therapists, especially speech therapists, that can help our patients in the training of their movements.
My Parkinsonian symptoms were primarily tremor, which was the main thing from a physical standpoint. My handwriting was shot, and that was the first symptom that I noticed ever, was my handwriting.
Well, I was a construction worker for many years, and I like working with my hands, and when I started getting this essential tremor, I was getting very frustrated because my hands didn't work like they used to, and I couldn't do things the way I used to do it. And it was getting hard for me to sign my name where anybody could recognize my signature.
Finally, 2 years ago, my doctor, Dr. Burdick at EvergreenHealth, recommended I consider Parkinsonian treatment through DBS, deep brain stimulation. And so I fought that initially quite a bit. And then as the disease worsened, I thought, well, why not try this?
Deep brain stimulation is a tool to interact with the brain to help modify pathways in the brain that have been affected by chronic diseases such as Parkinson's. Deep brain stimulation allows us to help push those pathways back towards more normal functioning.
I have seen so many success stories in the time that I've been with EvergreenHealth. I've seen patients go from not being able to feed themselves because their tremors are so bad they can't bring a spoon to their mouth, to going from that to being able to hike mountains.
I felt like I was cured from the disease, at least for a while. And then I understood more carefully that only certain symptoms are controlled by the procedure. But those symptoms were so dramatic, they changed my life in terms of everything I did, from washing a car to fixing a meal to hiking up Mount Si, which is a 3,000-foot hike.
You know, I hated to go out in public for dinner or something because I couldn't keep the food on a fork. It'd be all over the place. And yes, it's much better. And I can even hold a utensil like a civilized person now. And it's really encouraging.
For people with chronic illness, they're always having to think, you know, as much as possible, 10 steps ahead, sometimes 20, just because they need to understand how their next action is going to impact their health and their longevity as a consequence. Everything you do is, in some respect, linked to your care management, to maintaining your quality of life, to maintaining your supports and services, any entitlements that you may have, maintaining your mobility, maintaining your socialization.
I came to EvergreenHealth because it was well known in the area as the top flight neurological care for this kind of thing. What I appreciate about EvergreenHealth is that I've always had immediate access to the care provided to the team. Parkinson's disease is a lifelong diagnosis, so it's really important that you have a care team that you trust and that you can put your faith in and that you have access to, and they feel like you're part of your family, really, in a way.
We have a large clinical trial program. In fact, we offer more clinical trials in Parkinson's disease here than any other center in Western Washington.
We've been very lucky recently, within the last 4 months, 3 new medications have gotten approved for Parkinson's, and we were lucky enough to be part of all of these trials. But the main need of the hour is to slow progression in Parkinson's. And so we have several clinical trials going on to possibly slow progression. And in the future, maybe as close as this year, we may be doing a stem cell trial. And we've also been approached about a possible gene therapy trial in Parkinson's disease.
Noting the development of the Gardner Parkinson's Care Center at EvergreenHealth over 25 years, it's become an essential touchstone, foundational support for the community at large.
We are continuing to look at partnerships to help meet the needs of the broader community, and that spirit extends to our collaboration, for instance, with Overlake Medical Center in supporting the East Side Neuroscience Institute, which will really help us deliver the highest level of subspecialty care to the entire East Side region of Seattle and beyond.
Thanks for watching this AAN TV feature. Now, an important disclaimer. Content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.